Good morning, and thank you for joining your El Paso Hispanic Chamber for another one of our Fireside Chats. Today we are so excited to have County Judge Ricardo Samaniego with us. Judge, thank you so much for joining us.
No, thank you for asking me to be here. It's
Yeah.
a pleasure and a privilege.
Thank you. Well, we know that there's been so much going on. We've been focusing on the state delegation because a lot of what's happening is really affecting, what Governor Abbott is doing has a long-term effect on what's happening in El Paso. But really, we wanted to check in with you to get a view of what's going on with the county, because here in El Paso, we've had a lot of different things happening, from redistricting to COVID numbers. So we're really glad that you're here to touch base with us on what's going on and give us a county update.
Well, hopefully I can help. People don't realize that the county continues and business continues, and COVID doesn't stop us from doing everything that we can. And so everything that always happens continues. But then you've got this distraction. I keep telling people, please, let's get this pandemic behind us because I can do other things. I've been so focused on the pandemic that I haven't had those opportunities to do some of the things that my background. I'm pretty strong in economic development. Trying to get more businesses in El Paso, or some of the things that are very important for us are there, but we have been distracted. Like any business, we've been distracted to do some of the very basic and fundamental things that we need to be doing in county government, but we don't. We try our best to continue doing what we need to do.
Yeah, and I think no one can argue against the idea that the county has really carried on. The county and city have really paved the way for how El Paso has been able to, from at one point having the highest numbers of COVID cases to now having one of the lower numbers in the state of Texas. And I think that is, a lot of people understand that that's in large part due to you and the mayor and everyone coming together. So I wanted to ask, get a little bit more into that. But just as a reminder to our viewers, this is a Facebook Live event. So any questions that you have for County Judge Samaniego, please type them in and we will go ahead and get them answered for you. So a little bit more about COVID. I know a lot of businesses worry about what's going to happen with COVID measures and preventative measures. And I know it's at one point before the vaccine, the city and the county had made the decision to limit activity. And you were speaking about that a little bit earlier. Can you tell me a little bit more about why that's different now?
Well, we knew very little about the virus, and we didn't know to what extent it was going to, cripple us as an economy, as healthcare. Healthcare is the basis of your economy. If the healthcare is down, everything doesn't function. So we had no vaccine at the time, and we tried to do as much as we could, and one of them was mandating or curfews or something. We had to slow down the process of going into these numbers that were becoming, at one point, I think we were not only in the country but in the world, that we had this crisis. And myself as a businessman, it was extremely difficult for me to make decisions that would disrupt a business, because I understood, I've had businesses all most of my life. I had businesses during the pandemic, and it was really tough for me to make a decision that looked as if I was not pro-business. And being accused of that was very hard for me, because they would say, you don't understand business. On the other hand, I had to really look at the healthcare. It was becoming a crisis. Sometimes someone that died in a household, it was taking up to 8 hours. And we're reaching a point where we might not have been able to pick up a soul during a 24-hour period. We're at that point. And so I had to balance that. But now we have different information. We know that if you're vaccinated and you mask up and you do the things that you need to do, we're in a much better position. So one of the things that I do hope today, because we get to do such an amazing job with small businesses, is that they don't feel alarmed or feel concerned that our steps are going to be to mandate or slow down business, because that's not something that will happen. I was at the parade in November, and I get a lot of cheers, but I also got a group saying, no shutdowns, no shutdowns. and I actually stopped the truck and had a conversation with them. And I said, don't worry, that's not going to be my approach or anybody's approach because we know that the economy has to continue, so we have to learn how to coexist with a virus, but that requires a tremendous amount of self-governance, of self-monitoring, self-decisions that they need to make because every business is so different that it's not going to be a blanket decision. And I mentioned earlier, for example, at the outlet malls, there's no mandate. People have to wear their masks inside the businesses, and they also are limiting the number of people that come in. And so I think if you look at every business says, how can I have great quality, keep my employees and the customers safe, and how can I balance that? Then that's the decision that they have to make. To achieve that goal, everyone has to make a decision based on their particular situation. And I think that's the new outcome. It's no longer a blanket kind of thing, or we're going to do X, or we're going to do this. The more knowledge you have, and that's why I'm very privileged to be here, because we need to inform the community of what they can and cannot do and what options that they have. And once they put all of those options together, I think they're going to feel good to be able to make a decision. One of the things that was disruptive was that the business entrepreneurs are very high-spirited, they're ambitious, and it was sort of like, how dare you tell me what I'm supposed to be doing?
You're overstepping.
You're overstepping, and now I'm turning it around and saying, you make that decision.
Right.
Not us. Will you make the decision? We'll give you the resources. Hispanic Chamber has been incredible, whether you need masking, you need whatever you need. They give you guys have packages, you've got all kinds of things that you need for it. So you make the decision, and then we'll support that decision with resources. I think is the new trend.
Yeah, and I think that for a lot of business owners, there is concern because of the breakthrough cases that we're seeing. A lot of people have gotten both their vaccines, they've received their booster, and we're still seeing the cases come through. Now, it's not as severe and it's not taking up hospital beds, but for employers who want to keep safe and small business owners, do you think that self-governance and making these calls individually is the smartest thing to do, or do you think that something needs to be set in place?
Well, because I think I'm going to be very blunt about, if I get vaccinated in January of last year, my protection is completely gone. And right now, our percentage of boosters is extremely low. So I don't know why we haven't really said, well, wait, one of the reasons that it's going to be easier to get, and I'm not a doctor, and I'm not proposing that I know that much, but I think logically speaking, if my protection has gone down because I haven't received the booster, or my last vaccination was eight months ago, then I'm not as protected anymore. And so the chances of a breakthrough are much greater. And I'm just being logical, right? I'm not being medical about it.
Right.
But we were told the reason you get a booster is because your protection has declined. And our percentage of our boosters is extremely low. And so I think that's one of the culprits is that we need everyone finish getting the vaccinations, get the 2 vaccines, but we have to get that booster. We have to keep up with the science, and the science is saying that you need the booster, otherwise it would have been proposed. And so that's one of the things that I worry about, that people tell me, I've got my 2 vaccinations, and I ask them when, they tell me February of last year. My goodness, that's not logical. So anyway, I think that's one of the culprits. So if you take the booster, right, and you mask up when you're in a vulnerable situation and you're feeling uncomfortable because you don't know what the other person, you wear the mask, I think it's going to really be the best protection that we have.
Okay. And as far as the boosters, why do you think El Pasoans, because we're a little low in our booster number. Vaccination numbers were very good,
Amazing.
but our booster numbers have faltered. Do you think it's a false sense of security from the booster?
Well,
I'm sorry, from the original 2 vaccines?
Well, that's what happened when people started getting breakthrough cases. They started doubting that the vaccination was necessary. And we also know that the Omicron virus spreads very quickly and throughout the community a lot faster. And so people are saying, well, I've been vaccinated and I still get the virus. So it's been hard for us to market that, to say, You need to get vaccinated. You get the booster when we're showing evidence that people, there's almost 65% of our cases are breakthrough cases.
Mhm.
But we always talk about the two vaccines, but we haven't included the booster as part of that. And so I don't think we finished the full cycle. Boosters are going to be probably something we're going to do, like a flu shot, like you mentioned earlier, as something. So you look at everything you have to do, we're not doing it completely. For us to be able to say we're doing everything possible and we're still getting a high number, I still think that we need to be a little bit more vigilant about the booster, about wearing a mask when you're not in a comfortable place. And obviously we're, not losing any more people because those numbers of death are beginning to come back up.
Right, and hospitalizations, I know that you and the mayor just recently had a press conference in reference to the number of cases that are showing up at the hospital. Is that a big concern for El Pasoans that we're not taking, maybe, there's a thing called COVID exhausted, and it's
Yes.
like, are we in that phase where El Paso is just COVID exhausted and we're tired of masking and being home? And
It's a phenomenon that was seen in the 1918 Spanish flu,
Mhm.
that there was a denial. Kind of, you look for any information as to what happened or what people did, it's not there, And so one of the things that happens is when you start feeling better.
Mhm.
Think about it even when you're taking medication. What's the first thing you do when you start feeling better?
Right.
You stop taking it, right? You go,
Yeah.
oh, I'm feeling better. And
Even
the
though your doctor gave you a prescription,
Yeah,
you're
for-
like, I feel
for
great.
10 days. So it's sort of, we were talking earlier about almost like the psychology of
Mhm.
a pandemic. How do we as individuals address a pandemic and don't allow some of our human nature to become a problem?
Right.
Denial that it exists after a while is very common.
Mhm.
And there I can talk a little bit more authoritatively because I was a clinical therapist for almost 12 years. And
That's very. You are one of the leads on mental health and getting through difficult times. So yes, please tell us.
Yeah, well, we know we have a huge crisis in mental health. Suicides are coming up. I see in my own personal life how it's more intense, like something that would be at one level is now at a different level, and it's difficult to address. And I see that around the community. You see drivers more aggressive. You see violence going up. You see more murders in El Paso than usual. And so we have to understand that there's a pandemic and then there's a collateral impact of the pandemic. And that one we're not looking at. Like, what did the pandemic do to me at a personal level that I got to address that? If you were depressed, you're going to be much more depressed.
Right.
If you had anger management issues, you're going to have more anger management issues.
Right.
And so it's going to sort of catapult to the next level. And I don't think that people are understanding that the collateral impact of the pandemic could be much more tough on us if we're not aware of it.
Right. It's not just the virus going around, it's the impact that the virus has had on individuals and their situation prior.
Absolutely.
I remember reading articles about how incidents of domestic abuse went up when there was virtual learning and everyone was working from home. There was just so much pent-up aggression that oftentimes it was taken out on family members, and so police were responding to more domestic violence issues.
We don't realize that anytime something major changes in our life, our way of thinking should change with it, and it doesn't. We continue to think the same. One of the things I'm very concerned about is that people are saying, I've learned a lot about the pandemic, I'm going to be more appreciative, but they think it's going to happen on its own. And it won't. It actually gets worse before it gets better and you have that sense of awareness. I'm actually working with someone right now on putting together what we learned from the pandemic and how could we have done things better, and then how do we come out of it better, because society tends to move away very quickly from a crisis without really understanding it. For example, if the 1918 Spanish flu had said, this is what we learned, then we could have grabbed that and we would have been able to say, hey, you know what, man, this is what happened, this is how they dealt with it. So I'm not about to go forward without really spending a lot of time in trying to figure out how do we help the next virus that comes along or the next generation that has to deal with what we're dealing. We cannot afford, they say, history repeats itself because we don't learn from it. That's why it repeats itself. And I would hate that our numbers continue to go up the way they do, and we forgot. If anybody should have been sensitive to high numbers, it would have been us for two reasons. We were the highest, but also we're one of the most vulnerable communities in the country. We've got one of the highest indices of diabetes, of cancer, of heart issues. And so if we as a community have to be much more cautious than anybody else. It was so disproportionate. The number of people that died during the pandemic, which we're now at 3,180 almost now, and we're actually having a mass for those that died this Sunday with a bishop, because I think we need to really hold on to the fact that there's a lot of great things we're unique about that we can feel very good about. But one of the uniqueness that we need to worry is that when we get a virus, more people die than in any other community. And that should be something that we hold on very dearly to say, I don't care what anybody else is doing. We cannot afford to get those numbers high because we'll have more people dying disproportionately than any other community. And that's what we got to think is, we love the unique part rather than, well, we're unique and we're a culture and we're, symbiotic relationship and all, but we're also unique in some negative aspects.
Right.
And that's something that I'm really going to address going into my next 4 years is that I'm going to address, make sure that we look at the prevention and make sure that when if we get hit by a virus, how you're going to manage it has to do with how healthy you are. And you know what? It's really difficult to say. It's embarrassing to say, but we were a very unhealthy community. And it's not their fault. We had, we need better insurances, better access to doctors. We had all this advantage and luxury of having telemedicine, yet we had so many people that weren't able to have broadband to be able to get telemedicine. So we can't walk away and forget that we have to take care of a lot of things for the next virus to be.
And I think I think that there was also a shortage of doctors. Like I remember even when I was looking for doctors, everyone was booked for like 3 months. So if you needed anything, it was very difficult to get anything locally. So with that being said, I know that mental health and veterans and making sure active duty military are taken care of and feel at home in our city is at the forefront of everything that you believe in. Now that you are going to be serving another term as our county judge, what is at your forefront? What is on your agenda?
Veterans are very important because before the pandemic, they already had health challenges and they already had mental health challenges. And so because of that, we know that they're going to be more critical. They're more at a disadvantage. Their services need to be improved. I've been proposing that we become the Veterans Capital of the U.S. and we have every right to do that. But then we're going to have to challenge ourselves. We cannot call ourselves that and have veterans not being seen and veterans being set for an appointment. I mean, right now, our health care and our mental health care is not prepared for the challenges. We have one of the highest turnovers that we've ever had. A lot of the healthcare workers have decided that they don't want to be in that vulnerable situation. There's a lot of lack of appreciation for what they did. And so right now, our biggest challenge is lack of personnel. I don't care what you mention, whether it's teachers, first responders, healthcare workers, their biggest challenge is staff. Look at what happened when our testing. Look at the long lines. People say, well, why are we having these long lines? Well, one, we're not being careful as a community, and two, we don't have the staff that we used to have to be able to do that.
I believe an article came out that 20% of the sheriff's office and 20% of the testers were COVID positive. So there was a shortage, not only for those 6-hour long lines that we saw, there was also a shortage of staff who was able to accommodate them.
Yeah, and you know, it's really difficult to balance that, to be an alarmist. Like I worry tremendously as to what can happen. I'm the one that has to look at the trajectory. The community looks at what's happening now, and I look at the trajectory. If we continue going in this route, what's going to happen over here? And that makes it difficult because I'm seeing something that the community might not be seeing.
Right.
For example, right now the biggest challenge we have is non-COVID patients at the hospital.
Right.
We have one of the highest, right now we're at about just non-COVID could already take us almost to capacity because of delayed treatment. People were concerned, didn't want to be in hospitals. They didn't go see their doctor with diabetes. They didn't go see them. And so now, you know, what's going to happen with any big peak, we'll be over. When we had the peak last time, we're at about 55% capacity. So it took a long time to get to the full capacity. Right now, we're already there. And so if our
We're at
community,
55.
well, no, we're already at that point where we had another spike, a big spike. Now, fortunately, if you see the hospital, that's a difficult one to measure because sometimes we have like 600 people with COVID in the hospitals. It dropped down last week, but now there are more people in the ventilators than we've had before.
Oh, wow.
And so it's very difficult. And one of the things that's the most difficult is when you got tested before, you got tested by an official site, and we knew exactly who was positive and where they were. But now that there's self-test, and you're not reporting that test, right? So like today we had like 1,700, but we don't know how many self-tested that home tested, and now how do we know that number? And so as leaders, the mayor, Lisa, and myself, we depend a lot on numbers.
Right.
So if people aren't reporting, and all you have to do is say, look, I tested positive and call the public health, nothing's going to happen, at least we get you in the system, because we make a lot of decisions based on the numbers and the statistics.
Right.
And right now, I've used the analogy that it's like playing a basketball game without a scoreboard. And you don't know where you're at. You don't know if you're two behind, 4 behind. So
Just try really hard.
Like
to
try
do
hard,
rest.
but you don't know if you're behind ahead, and it makes it difficult. So
Right.
to me, that's an analogy that I see right now, is that as we move forward, it's going to be more difficult to really have the statistics to help you put the science and the politics together so that we can address a problem. Because right now the numbers are extremely skewed.
Right, we don't have those numbers, but really what you're saying is all they have to do is call into the city,
Exactly.
report that they're positive, just so that there is someone keeping a tally of what's going on, because everyone is getting those at-home tests to take, and everyone is using that or going to an urgent care pharmacy, so it's good for people to know.
There's another level that's really difficult because before you got tested positive, people knew that, and you could go to work, and
Right.
people knew that you were being governed, right?
Yeah,
But let's say today I take the test and I'm positive, and now it's going to be up to me to say, do I want to go to work? Well, I don't know. You know what? I'm just going to mask up and I'm going to go to work. And
then
nobody knows that person is positive, right? And so that's an additional criteria that, when I said earlier, self-governance is going to be so important, not only as a business, but as a person. Because
Right.
it's easy for you to go to work even if you tested positive because nobody knows but yourself.
And that's where it comes into play, I guess, where if for businesses and workplaces, it becomes how do you address that? Because for a lot of jobs, there aren't those sick days in place, or there isn't that leave in place. So being out for that long, 5 to 10 days, could mean missing a rent check or missing.
What happens is that, and we've seen it throughout history, is that the leader of every organization will determine the outcomes of the individuals. If the leader of the organization says, hey, we don't want anybody to die, we want everybody to take care of themselves, and if you have a symptom, stay at home, and everybody's thinking in those terms. And I'll use Joe Materials, for example. They're at about 92% of vaccinations of their employees, because they've brought vaccinations to the site, they've invited their vendors, they've invited other people to join, And so they're 92%. And so their vulnerability is less. And the resources are out there. A business can actually say, can you bring, can you help me test? Can you help me with vaccine? I can tell you, Chief Rodriguez, Jorge Rodriguez does an excellent job of providing resources for the companies and what they need. And that's all you got to do is say, I really want to take care of my employees. Can you help me with that?
Mhm.
And that's where I think that I've always said, there's always a patriarch or a matriarch in every family. And if that patriarch or matriarch said, I'm going to take care of my family. I'm going to do everything possible. We're going to vaccinate, we're going to wear masks, and we're going to. So we need leaders inside the family. We need leaders inside organizations. And once we do that, I think then we'll be able to control it. So once again, it's a lot of self-monitoring and self-respect, right?
And I think it's so difficult for people because, as you were saying, there's that exhaustion of like, year 3, the mask, like, but I think, as you're saying, it's important that we keep doing that so we don't have to have any closures or anything put down. But I know that, when retired military come here, as we were talking about the making us a veteran-friendly
Capital.
city, a veteran capital
US,
city. Sorry, veteran capital.
Or a veteran-ready community.
Okay.
Is the best term.
What can you tell me about that? Like, if El Pasoans want to know, how can we help? If businesses want to know, what do we do to get El Paso to be that veteran capital? What does that require of us?
Nobody's going to crown us. We're going to have to gain it.
I was hoping we'd get a crown.
There you go. I'll give you an example. San Antonio calls themselves Gateway to Mexico. They're 125 miles away.
Wow.
Hatch, the best chili in the world, but nobody gave them that title. They said,
They just made it.
We're going to be that.
Okay.
So one of the challenges is that I'm working with community members and business members that are veterans, and I'm very passionate because I lost my brother in Vietnam as a helicopter pilot, and he was the first fatality of El Paso.
That's right.
And so I really feel very motivated to make us that capital, but then we have to defend it. We have to do the right things. We did a survey in back about 2.5 years ago because we kept saying, we can't say this is what they need. Why don't we let veterans tell us what they need? And that's what we're doing now. We're trying to execute and all the things that they said, we need these items and we need these things and these services. We're trying to address that. I can tell you it would be great for veterans to be the veterans capital of the U.S. It would be great for our community because veterans are very loyal, and as they're passing down I-10, they're going to say, well, you know what, I'm going to stop here. And we have a lot of things to offer, flights across America, we have museums, we have some of the most incredible veterans of the country. We have people, that have done amazing things. We just had one veteran that died that we've been honoring, and that's Lieutenant Colonel Chisholm, who was World War I, World War II, in the Korean War, and in Vietnam, and got wounded in each one of them. And I can tell you that's the people. And if you ever want to see how disproportionate, how many people died in El Paso, it was disproportionate. I mean, my senior class lost 13 people died in my senior class.
Wow.
So El Paso has put their lives, have been there. Hispanics know how to serve their country, and so I think we deserve it. But like I said, then we have to defend it. And I've got a lot of people that believe that we could be the veterans capital of the U.S. and I'm not going to give up until that happens because I know we deserve it.
Yeah, I agree with you. I think that, having Fort Bliss here and the people who decide to stay there is such an asset to our community. We should definitely work on that.
Absolutely.
I wanted to ask you some questions that's recently been going on County Commissioner's Court. So I know that there's a possible change for Escalante Park, name-wise. And I also know that there's talk of a partnership with Fabens
Yes.
and UTEP. Can you tell me a little bit about that?
Well, those are the two things I love. One of them obviously is Escalante has been this community park for us forever. I don't care how far back I'm sort of dating myself, but as a child, my parents took us there. So it's a very iconic, beautiful place
Yeah.
that we've decided to take way over to the next level.
Mm-hmm.
And I feel that a name change, well, not Escarate, right, because it's from a very prominent family that deserve that name, but some kind of combination. And I threw out Escarate Meadows, and so I feel just to challenge.
Yeah.
I didn't say that was going
Just
to be
to
the name.
test it out.
Yeah, come on, let's and I've thrown it out there, and it does give it a little sense. Yeah, I can't begin to tell you the master plan, and one of the reasons behind the master plan is that the virus did not take away our outdoors.
Mhm.
So the county is very dealing, say, look, whatever happens, you're going to be able to go outdoors. And Escalante
Right.
is an amazing place. It could be at the level of a river walk with retail stores around it. We're looking at a bridge that would go over Escalante Park. I mean, we've got everything you need to have one of the most incredible parks in the country.
Mhm.
I mean, there's water it's an oasis in the desert. That in itself,
Right.
you know,
I
brought
remember when Western Playland was right over
Yeah.
there.
and now at that same place is going to be one of the best concert areas. It's already been designed. If you go there, and you know, you have to go there again because people really keep thinking when you say Escada, it gives you the impression of what it used to be.
Mhm.
So maybe labeling it different would be great. But if you go to the Healing Garden. It's an amazing place.
I have been there. It is very amazing.
It's amazing, and so we have that as a little bit of an anchor. And then we've got the beautiful water. We've got a great golf course that has all kinds of new features now. We're going to have a marquee on the border highway that's going to be telling you of all the events, not only for Escada, but for the sports park. So our master plan for parks, I think, is going to be one of the best that you'll ever see. And Escada, I know I can envision, you know, the shops around there, the restaurants, and everything that we want. It'll happen. Right now, we're trying to get a really good concession. The contract has terminated on the previous ones. Fourplex is due for about a 6-month period.
Mhm.
But we're looking at finding, we want a name brand. I mean, I know if we had it, I'm going to throw it out there like that. Like if we had Taco
Fingers
Torte,
crossed.
like if we had Taco Torte that was there, then it would give you the sense, oh, it's changed.
Uh-huh.
So we're really working with the Texas Restaurant Association to come up with some really good brand, you know, restaurant there at the golf course. And I think that'll kick in this idea that we're in a much better place and then we're going to do some amazing things at Escada.
Well, that's exciting. I know. I watch County Commissioners Court every week, and so I was like following this ping pong of different names going back and forth, and I was like, I wonder what it's gonna be, because I think that for a lot of us, like the one saving grace during the pandemic was the outdoors, and so to really beautify our community and make sure that, you know, people really do, when they think about their mental health, being outdoors and active is something that we still stay, so we become a healthier city.
Oh, absolutely. Can I throw a challenge out there that really was painful for me, and I'll repeat it over and over? I brought the county judge of San Antonio, Judge Wolf, who was responsible for the extension of the river walk, and actually the river walk. He was a mayor and has been a county judge since 2001. He's now going to retire. And when I brought him to Escada, he looked at me and he said, oh my God, if this were in San Antonio, Judge Samaniego, this would be amazing. And I'll never forget that. What do you mean if it was in San Antonio? Why can't it happen in El Paso? I got stunned. I can tell you, I remember that every single day. How dare somebody say if it was somewhere else, it would be better.
Mm-hmm.
And I'm not going to forget that. And the community needs to come together and feel insulted like I
Yeah,
did. Like,
we all need to be upset about this.
I'm upset that somebody would say that if it were somewhere else, it would be amazing. And I'll
Yeah.
never forget that. And that's gonna bother me until
Until we get it done.
The river walk.
And I think that goes, like, how do people who want to get involved in this and in the beautification, whether it be businesses, whether it be individuals who want their voices heard, how do they get involved? Because a lot of them work full-time jobs. A lot of them aren't able to watch the county commissioners meetings or call in. What can they do?
I think by going to the park, you know, to do that, and one of the things I want to do when the weather gets a little bit better is to have, you know, focus meetings there. But the way it's going to work is that we're all gonna take a little run or get on a bicycle, say, and we did it twice, you know, like you get there at 7:30 and you do biking, you run, whatever you wanna do, go through the trails, and
I
then
will be
afterwards.
walking.
Or
I'm
walking.
not good at running.
Okay, then afterwards we can meet and have this discussion, because I want people to feel that it's their park. Even the healing garden, I don't want to say it's our healing garden. I want somebody to be able to say, let me take you to my healing garden, or let me take you to our healing garden. Not the counties, not the judges. Not this is a place for meditation and reflection, and so I want people to feel like that. And the only one, you know, that when we asked the victims of the August 3rd, or they wanted to have their first anniversary, they all said aesthetically, because it brought good feelings to them.
Wow.
And that's the way the community did. So we now have to sort of optimize that to a situation to feel really good about. You know, everybody's been to the park. They have stories and memories. Why not make that park memorable?
Right.
But not only to us, but to the rest of the country. And it has everything. It's got the water, a lot of acres, beautiful places. And like I said, the next concert, you can have food trucks there. It's all now in an area that it could be, you know, have one of the best concerts ever in El Paso, because it's got all the infrastructure now. But go by. I mean, you have to, not yourself, but our audience.
I too will go by.
Yeah. Check it out.
Yeah. Well, that's great. So my last question for you, because I know you're a busy man with places to go and people to see, is redistricting. I know that statewide we saw redistricting. We had the threat of losing Fort Bliss. Then the El Paso Airport was going to be moved to a district in San Antonio. It was crazy. But locally, we've seen redistricting change for you guys on the county. What does that mean for El Pasoans?
I think it changed for the better, because we were sort of lopsided. We had almost 45,000 more in one of the precincts than the other. And now it's sort of very balanced to about 225, 230. It's balanced. You know, Commissioner Olguin lost about 45,000. She's an amazing commissioner.
She's a doer.
Yeah, she's a doer. And then you have also a great commissioner, Commissioner Leon, who got the majority of what she lost. And so I feel very comfortable. You've got one up and coming that's going to do a great job, and you've got a veteran that you have like Commissioner Leon. That he'll take care of that district. And then the other thing that was very helpful, and I got to thank the commission that we put together, they were amazingly, I mean, they worked hard. And one of the things that they didn't separate the constables from the JPs, so everybody stayed intact.
Oh, okay.
And that could have been disastrous, because if a constable lives somewhere else, then he'd have to go to the other one. Sort of what happened in the situation with Representative Fierro and Representative Ordaz Perez. You know, that it created some kind of a situation there. And, you know, I've got to meet the new representative there, and so you've got, it wasn't difficult for us, but the whole thing that is better representation. You know, we don't want to, as they say, we don't want politicians to choose their voters. We want voters to choose their representatives. And I think it's very manageable, and we're sending out information now on the mail. So anybody that changes for them, they're going to get, you know, something in the mail. They're going to, your new representative now is either Leon or Guin. It depends where you're at. And so I think we're very fortunate that we had that, the redistricting was not that difficult for us. But I'll go back to the commission. They were long hours, and they did everything possible to maintain the integrity of what we already had and make it better. Like I said, now 45,000 people are better represented, number-wise.
Right.
Because
so
before
this
it was lumped into.
Yeah, this is better for El Pasoans because they have more, not so much individualized, but more individualized access to their representative because the numbers are a little bit more evenly spread.
Well, look at what happens, for example, when we have Gonzalez, who takes all the way from San Antonio, comes all the way into our area.
Yeah, where does he start? Like Yarborough?
No, he's further down, like he catches some of Sonali in that area.
Oh, yes.
I'm talking about the Congress.
Congressman,
Gonzalez.
Congressman Tony Gonzalez.
Tony Gonzalez. So, but see, those things should never happen where you've got representation from San Antonio
500 miles away.
away.
Yeah.
And so we're chopping away a little bit at a time. But I think it was very, very positive for our community. And if you don't mind, if I could talk about the about favors. Really
Oh,
quick.
yes, no, go
very,
ahead.
Very quickly, because
Yes.
people don't realize that we have one of the greatest potential for having an aerospace district here.
Okay.
We've got UTEP, Boeing, Lockheed, Blue Origin, Raytheon, very, very interested. And as you know, we lose almost 90% of our engineers. We're one of the best exporters of talent, bilingual, extremely talented, unentitled engineers that go all over the country.
Mhm.
And UTEP has a program called 3000 and 2030 that we would keep 3,000 engineers. It is a sad when you hear about how many leave after they're trained and developed here.
Yeah.
So one of the things that Dr. Shadari from UTEP is doing is he's now saying, we're going to export some, but if you come over here, you're going to have to guarantee that our engineers stay here in our community. And so we've gotten a $5 million grant already to improve the airport. The airport is a very collateral part of it. And we have now hangars with research on what UTEP is doing some of the most advanced engineering things. Like we're one of the few that have a satellite that no other university has had a satellite. They have 3D where they can actually repair the satellite without having it to land. They could actually fix it. And so our students go through an amazing program and then we lose them. And I don't want that to happen again. So this thanks to Dr. Shadari from UTEP and all his partners, and he could be at any university in the country, any university, and he chose to be at UTEP. And I said, why, Dr. Shadari? He said, when somebody's going to go to Harvard, they were going to go there anyway. But when I have a kid from Fabens and we develop it and he gets a PhD, he goes, that makes me feel extremely good.
That's great. So it is specifically with Fabens.
At the Fabens Airport.
Okay, so we'll be training and maintaining engineers that will be working in El Paso to help us.
And finally, the opportunity for UTEP to have a branch. A lot of things that are right now. There's almost 65, 70 engineers and interns working there, or developing projects there at the Fabens Airport. And so we needed to get closer to Fabens. It takes a long time for a student to go all the way to UTEP. So some of the classes can now take place there at the airport. We did get the most improved airport in Texas a few months ago, and got recognized for that. And so it's an amazing program. So right now, El Paso, if you look 5 years from now, we're probably going to be one of the best healthcare. People are no longer going to go through here and go to Phoenix or to the Mayo clinics and all that, or Dallas. We'll have it here. So healthcare is going to be really big. Aerospace is going to be amazing. And I think people wanting to see El Paso as a destination. You've got beautiful hotels, some of the best in the country now. And when it all comes together, I think it's going to be a destination. It's no longer going to be a drive-through. People passing through I-10 without stopping.
Yeah, and I think the brain drain has been a constant issue for us for years. So it's nice to know that your agenda items for your next term are going to be to enrich El Paso and
Absolutely.
make sure that we got to keep some of our talent.
Yeah, so I'm asking the community, let's sort of do the right thing so that we can have the pandemic behind us, because there's some amazing things that are going to happen, but they're very distracting when you're having to deal with high numbers and crisis in the hospital. And so as soon as we work on that, El Paso, you're going to feel very proud to be in El Paso. Right now is probably the best time that anybody will want to be in El Paso, because right now you're a little bit not so much at the ground level, but a little higher than that. But I think you're going to begin to see the things that other communities enjoy, the quality of life that San Antonio has, the quality of life that you see in other places like Austin. We deserve it. And one of the goals that I have is that, and I've said it over and over, that no one in El Paso County should live any different because they happen to live somewhere else.
Mhm.
You want to have the same parks, the same accessibility to education, to healthcare, to everything, no matter where you're at.
Mhm.
When I hear the word colonia, I cringe. Like that shouldn't be. That shouldn't be happening. We shouldn't be calling our community colonias
Mhm.
because they exist. And we have the most colonias of all of Texas. And colonias meaning the water supply is not there,
Yeah.
the sewerage and all these other quality of lives that we enjoy so easily. A lot of people still don't enjoy. There's still people that go to sleep hungry,
Right.
and that should never happen. El Paso, no one in El Paso deserves to live any different than anybody else would.
Yeah, that makes total sense. Well, thank you for giving us an update on your agenda, what we can expect from the county. And if there's a quick wrap up to stay safe during COVID, it's wash hands.
You know, just be aware of your environment, and like I said, like at the county, what we're doing now is we have a formula. How can we provide the best quality service in a safe environment that both for the employee and for the client that comes into our community? And then we figure that out. Maybe it's having people work from home, and that's what part of the solution is, or maybe spacing. But once again, I don't want any small business to start feeling that we're going to go into the shutdown or we're going to go. You would have to really push the envelope, and I don't think El Paso will do that for us to change from the idea of coexistence.
Right. It seems like everyone is interested in keeping us safe and putting protocols in place for
Yes,
themselves.
that's the rationale. And if everybody follows it, no better community than El Paso. I could tell you, everybody brags on us on how we come together, how all the agencies come together, how we collaborate. The Mayor Lisa, and I working together is rare. As we might already know from our own history, it's rare to have the county and the city working together.
Right. But
And
you
so-
guys have coordinated beautifully.
Yes, so we're in lockstep, and that's very important. And
Right.
it works. And like I said, I like to promote whatever faith that you have. We're going to have the mass at 11 o'clock at St. Patrick's this Sunday.
Oh,
In
that's my
honor
church. Yes.
in honor of all the souls and beautiful souls that died, but also to remember, that we're a very vulnerable community and we have to be extra careful. That we're healthy if we ever get another virus, or this virus will take a lot of people, and we don't want that to happen.
Right. Well, County Judge Samaniego, thank you so much for taking the time and joining us. I really
Thank you.
appreciate talking to you.
Thank you.
And thank you to all of our viewers for joining us for our Fireside Chat. Please stay tuned and we will let you know when we have our next one. Thanks.